It's time to focus on seniors with Helping Seniors TV. The television show designed to make you aware of senior issues and needs, as well as to acquaint you with the resources available to help you age in place and with dignity. Now, here's your host, Joe Steckler.
I'm Joe Steckler, and welcome to Helping Seniors, the television arm of Helping Seniors of Brevard County. Our show is designed to provide you with information on how to develop your own aging and care plan. Our topic today is heart attack and women. Joining me today is Dr. David Sims, cardiothoracic surgeon with Wuesthoff Medical Center. Welcome, Dr. Sims.
Good afternoon. How you doing?
I have to tell you, years ago, I had a dissecting aorta, and Dr. Sims, when I had him on a radio show, he remembered that he was there with Dr. Sanabria.
Correct.
They were going to cut me open and repair that aorta, and they made a decision was made that I was going to go someplace else, but you were going to do it, and for that I'll always be grateful because
we remember you.
You know, Doctor, when we talk about heart attack, care of the heart, care of the body to make our heart stronger, I at times don't think we give enough emphasis to what can be done, what we should be doing. And some of those things are very simple. And when I had you on the radio show, one of the first questions I asked you was, what is a heart attack? And our viewers need to understand in simple layman's terms, what is a heart attack?
Just think that your artery is supplying the heart with blood, the heart muscle, and for some reason, the heart muscle doesn't get enough blood. So if you think of what happens when you get leg cramps, you're kind of out walking your blood supply. It's not getting enough oxygen. That's why you stop and get cramps. Your heart's designed not really to do that. So what can happen over time is either the arteries can narrow down from having arteriosclerosis, or you can form a plaque. And the plaque is like, if you've imagined the inside layer of the artery builds up with a fat deposit, let's call it. That plaques can rupture and go, to the smaller arteries, and then it causes an area that doesn't get enough blood, and therefore that's really what a heart attack is. So when you present with a heart attack with chest pain, most likely you had a plaque that ruptured. It went distally, meaning as far as it could go into the little arteries into the heart. You don't get enough blood. It causes a cascade of events that really, that's all it's leading to, is the fact that your heart is not getting enough blood.
I think it's hard for a layman to understand is that when doctors explain a heart attack, it sounds so simple as to what's really happening. But then when you have a friend that has a heart attack, there are so many other side effects. There are so many things that happen. Sometimes quick action can mitigate the effects of a heart attack. People are saved. What are some of the elements that cause those kind of things to happen the right way or the wrong way? Is that a question?
I think so.
Okay.
In other words, if you think you're having a heart attack, one of the first things they say is to take an aspirin. I think a lot of people know that. The reason you want to do that is when that plaque I was talking about ruptures, your body will start forming clot around that. And the clot is what's causing the obstructions in the arteries. So if you take an aspirin, it inhibits the platelets, which are making the clot. So that's one of the simple things people can do. Usually when you call 911, that's one of the first things the rescue guys will do. But I think the main thing is just recognizing that you could be having a heart attack, which is usually, I think people know the classic signs, but let's talk about
What are the classic signs? People
can get chest pain, chest pressure, pain down the left arm. It can also be the right arm. Classically, that's the male heart attack. Of course, it was, when we talked to the radio show, it was Women's Health Month. And one of the things that women can get is a lot of times they can get short of breath. They can get nauseated. They can, even vomiting, fast pulse rate. They just don't feel well. You can just get fatigued. You can talk to any doctor and they'll tell you they've seen every presentation of a heart attack. I mean, people can come in with jaw pain. They can have a toothache, believe it or not. I saw that one time. And so really
A
it's
heart
just,
attack and a toothache?
yeah, actually the lady was having chronic chest pain. Like, some people will get chronic angina, meaning they walk, they get chest pain, they stop, they know to take a nitro. This lady presented with a chronic tooth pain. She had seen every dentist and they finally figured it out. And they finally said, listen, let's just do a catheterization. And sure enough, we ended up bypassing her and it took away her tooth pain. So it can just be, it's just radiated to that area. But I think the main thing is just recognizing that you're having a problem. Specifically with females, what I've even learned over time is that a woman can just be having fatigue, just not feeling well, as if she has a flu symptoms. And I think we had talked about before, there's a lady in our cardiac rehab unit who is a relatively young lady, under 40, looks like a perfectly healthy lady. And she was sick for weeks. And I guess she had gone to her family physicians. They had tested her for Epstein-Barr. They thought she was having some kind of chronic infections. And then finally she had a big heart attack. And when they looked at it, that's probably what she was having over time, was just chronic angina, and then finally had a heart attack. She was bypassed and now she's fine. But I think that, a young lady in her 30s comes to a doctor complaining of fatigue. I think that, might be one of the last things we thought about would be having a heart attack or having, a heart disease. It turns out it can present in many different ways.
Well, you did an article.
Is that a long answer to a question?
No. You did an article that I thought was an extremely good article on heart disease in women. And it was just published in our recent edition of Senior Scene magazine in our newsletter for helping seniors in there. But you made it very, very easy to understand what's happening. I think there's so many people, and I include myself. I can remember years ago when I was a young officer in the Navy, I was under a lot of stress at the time, and I get a pain right here. I mean, it would double me over. Mm-hmm. And I was in Newport, Rhode Island at the time, and I'd go to the doctor, and one of my shipmates would take me to the doctor at 2:00 in the morning, and they said, Joe, it's not a heart attack. I was having some kind of an ulcer type reaction.
Okay.
But it felt like a heart attack. I was sweating.
Well, just getting back to that, we see plenty of, not plenty, but you'll occasionally see patients that present to their GI doctor and they end up getting an upper endoscopy because they think they have an ulcer. And then finally the GI doctor will say, hey, I think it might be your heart. And sure enough, they get a catheterization and it was the heart the whole time. So it can present, people think that they're having GI complaints and it can turn out to be their heart also.
I've had at least 2 heart catheterizations. I guess, are they serious to do those things or?
Well, I mean, the catheterization is not something I do being a surgeon, but.
You don't do that?
No, that's what Dr. Kalevi would do.
He did mine, yeah.
Right.
And they did it up in Pittsburgh one time.
Right. So the cardiologist is the doctor that will diagnose your heart condition, do a catheterization. If they find an obstruction, they can either treat it with, medication, they can put a stent, or if you can't be stented for various reasons, then they would refer you to me and we do bypass surgery. So we're the surgeons.
So a cardiologist does the stent thing?
Does the stents.
So then doctors, cardiothoracic surgeons, mm-hmm. What do you do once you open the chest up? That's the starting point, right?
Correct. I think I can explain this without any pictures, but when we open the chest, we go on the heart-lung machine. We drain the blood out of the body through a machine. It comes out the big vein in your heart. The machine oxygenates the blood, takes the CO2, which is basically what your lungs do, and then pumps it back into the main artery. And we do that through all here. And then we stop the heart in order to operate on it. And then when we bypass the heart, all we're doing is getting blood past the obstruction. That's kind of a simple explanation without pictures, but that's what we do.
But it's understandable. But what you're saying, and I'm going to use the word casual. I know it's not casual, but by your casual, treatment of the complexity of the body and what's happening, I hope more of the viewers understand that medicine has advanced, and especially with having doctors like you and Sanabria, Kalevi, and the other doctors that do all the patchwork and everything up here. I don't think there's not too many problems, given the right circumstances, if we can catch it in time and a person's in fairly decent health. When they go under the surgical procedure, they got a pretty good chance to come to the other side.
I think so. I mean, things are getting safer and better with time, especially with surgery and even our treatment of heart disease. But I think, one of the things we want to focus on is preventing it, because preventing heart disease is really, it's 100% possible. So we had talked about.
Wait. Are you saying that a person, if they do what you're going to talk about, can actually prevent the situation where a person has a heart attack?
Basically, yes.
Please go ahead.
Well,
pay attention, viewers.
If you look at other countries that don't have the foods we have, that don't smoke, that don't have cars, and they have to exercise, they don't have heart disease. I mean, coronary artery disease was basically unheard of 300 years ago. And then if you look at, let's say, Russia or India, back in, let's say, the 60s, when they started keeping data, they basically, like India, had like a 1% chance of 1% of the population had heart disease in like 1960. Now it's probably up to 20 to 30%. So you have to say, well, why is coronary artery disease getting so prevalent? And really, it's the foods we eat, it's smoking, and it's a sedentary lifestyle. So really, to me, heart disease is kind of a product of modern living, right? We have easy foods we can eat, junk food, whether it's high fat or high carbohydrate, and then we just don't do as much exercise. So if you look, they did a study in China where they looked at villages where you had basically no heart disease and they had no vehicles, so they had to walk everywhere. And then you would see areas where they would get cars, and over a 10-year period, those areas would have an increase in heart disease just from a sedentary lifestyle. Pretty impressive.
It is impressive, but it's also scary, because it's scary from the side of a person getting older, having additional problems, like some of us have something called fibromyalgia, which affects the legs, the joints, and it makes it extremely painful at times to walk. I used to go to the gym and work on a gym every day of the week, at least 5 days a week. I can't do that anymore.
All right.
And I take my roller and I try to walk, but not as much as I should walk.
Right, but you also have to, so I always tell everybody, if you take care of yourself when you're young, it's going to pay off when you're older. So at least you didn't smoke, right?
Yeah.
So if you do all the right things, I think it pays off in the end. Something else people don't talk about is with smoking. And I tell everybody, if you don't smoke for your whole life, and then you need a big operation when you're 70, you're going to get over that operation no matter what it is if you're a non-smoker. Whenever you see smoking campaigns, right, they say smoking is going to cause lung cancer and heart disease. But nobody ever talks about this. It takes away your reserve, your ability to get over it, whether it's an infection or whether it's an operation. So if you take two guys that are 75, and the one guy has smoked for 50 years and the other guy hasn't, and they both get the same operation, the guy who didn't smoke will be out of the hospital 2-3 days. The other guy might be in the ICU a week, all because of cigarettes.
How do you get people to believe that, Dr. Sims?
I don't know. I'm not sure, but I do know this. If you quit smoking, I always tell everybody, don't throw the towel in if you're a smoker. Don't think, well, I've smoked 50 years, I'm never going to be able to quit. If you can quit and you don't smoke for 1 year, your risk of heart disease drops by 50%. So just think of that. Usually everybody says, well, if I quit smoking, it's going to take me 20 years to get better. It doesn't. First off, your blood pressure will drop in a couple of days. They say your circulation increases within a few months. If I know people that smoke and I see that they stopped, I can see it in their face because I think their skin actually looks healthier. But clearly, your risk of heart disease will drop by 50% in 1 year. Your risk of stroke drops in a couple of years. And if you don't smoke for 15 years, your cardiac risk goes down to normal. And your risk of lung cancer drops significantly from stopping. So it is something that it's worth stopping.
I've never had, of all the doctors I've had on TV shows and radio shows for 25 years,
Really?
No one has ever made the comparison you just made.
I think, when I try to get my patients to stop smoking, especially before lung operations, I don't get up and stand there and preach. I don't think it works. You can tell somebody 100 times, it's just not going to work. But if you give them a short-term goal, I think that's what we need, right? If you're going to go if you're going to paint one room in your house, it's okay. If you got to paint the whole house, it's overwhelming. But if you have a short goal, I think it's achievable. And I think it's something mentally people should keep in mind if they're trying to stop smoking.
I quit smoking when I had command of my first submarine. And if a person can quit smoking while you're in command of a ship with all the problems we had, I think you can just about quit any time, any point, if you want to do it badly enough. If you love your family enough, if you can develop the right reasons, you can just about do anything you put your mind to. But you have to have a desire to want to do it. Do you work much as a cardiothoracic surgeon and with all your experience? And doctor, you mentioned the circulation in the legs and water retention, fluid retention. What is your opinion on diuretics? And or is that a question? Is it fair to ask you? Not really.
Not really.
Not really. Let me ask.
When you say diuretics, what do you mean? Routine diuretics or?
The one I'm thinking about is a pill called Bumex. You heard of that?
Mm-hmm.
I was on diuretics because of water retention. I was on HTC, but the dermatologist thought the HTC was causing an eruption under my skin. So they put me on Bumex. That Bumex it killed me.
Really? That's not my specialty at all, really.
No.
I give Bumex right after heart surgery, but then we pass it back to the cardiologist or family.
If you want to keep somebody awake at night, have them take Bumex.
Yeah, they'll be up
they
all
will
night
never
in the
go
bathroom,
to sleep.
right? That's
yes.
right.
Yeah.
So it's effective.
It is. And that's the thing. Do doctors ever talk about the effect of what pills do? When is a good time to take a pill like a diuretic? If you take it during a day and you're working, you can't run to the bathroom all day long. If you take it at night, you're awake all night.
That's true. That's why, most people try to take their diuretic in the morning and try not to take it at night. They should be instructed to do that, because if not, you're going to spend all night going
That's
to the bathroom.
I figured that out. I tried that. But you made an observation about care when we're 20s and our 30s and lifestyle that I think needs to be discussed more published on it. And I think somehow we need to get our younger people to think more about how they're caring for themselves at a young age so that they don't become a burden on themselves or others when they're older. We are living longer.
Correct.
So what we do early on in our life is going to affect our healthcare older. And as a cardiologist, cardiothoracic surgeon, you see the damage that we willingly inflict ourselves. And I don't think those e-cigarettes are I don't think they're any help.
I don't think the jury's out on them, how good or bad they are. I don't think we were born to smoke. I think our lungs were not equipped to do that. So it just
they were not equipped to ingest smoke.
Correct.
But we get back. I think it's interesting because I've talked to women that do exhibit some of the signs that you talked about in women's health care, but some of the factors, the risk factors that we talked about on the radio show. Could we just talk about those, like the cholesterol, stress, blood pressure, and weight?
So that if you look at all people with heart disease, 70% will have abnormal lipids, and they'll be smokers. So if we talk about abnormal lipids, I mean, people know what cholesterol is, I think generally. Your total cholesterol doesn't necessarily matter. And actually that's something new in the government puts out guidelines for eating, for what food intake. And they even came out this year that total cholesterol doesn't matter, because it turns out your body makes about 80% of your cholesterol anyway. But there's good cholesterol and bad cholesterol. So I sound like a commercial for one of the drugs, but there's HDL, which is your high density lipoprotein, and then LDL. So HDL is your good and LDL is your bad. And what you want is that ratio of the HDL to LDL to be high, which just means more of the HDL than the LDL. So that's what you're working for if you get a lipid profile. And it turns out that the reason that's important, if you have high LDL, you tend to form the plaques in the arteries more easily. Your body tends to want to form those plaques when you have high HDL. It's that simple. So what you want to do is do all the things, eat the right foods so that your HDL goes up and your LDL goes down.
But when you're talking about these numbers, it requires a person to have a blood test.
Correct.
When I was a young man and starting in the Navy, we got an annual physical. How many people today you think get an annual physical?
Probably not enough. The only reason I ever got a physical is when I guess I was 44, and my brother, who's 7 years older than me, actually ended up having a stent in his heart. He was 51 years old, had chest pain, ended up getting a stent. And we had no history of heart disease in our family. My brother's a non-smoking, scholastic physician. And he's the last person I ever thought would ever have heart disease. So it changed a lot in me personally and what to look for.
So what did you do differently?
I went to see Dr. Kalevi, and we did a stress test, and I think he did that for my brain more than his. We did something else called a calcium score. What they do is they put you through a CAT scan. Right. You don't need any contrast. They just take a few pictures and they take a general look at your heart and all the arteries, and they just score the calcium, whether you have a lot of calcium or a little bit. It's kind of a raw test, but it's kind of something, if you're in the intermittent category. I mean, I was 44, I didn't have any symptoms, just kind of a little bit of paranoia because of my brother, and the calcium score kind of settled that.
But and
I'm sorry, and I also had a full lipid profile to check.
Okay.
But my brother's lipids were all normal. Lots of people, that's the thing about heart disease, is the reason we talk about it a lot is because there's so much we don't know. So you can still have a normal lipid profile and still, form plaques in specific spots in your arteries. It's kind of frustrating to people, right? Because we don't have a 100% answer.
Are you saying that all the tests can show normal, yet you can still have plaque?
Well, I'm saying your lipid profile can be normal, and you can still form plaques. So I say it's a guideline. I mean, we definitely know that high LDL will lead to heart attacks. We know that, but just because it's normal, it's not 100%. Do
you think it would have been an advantage when we did the Affordable Health Care Act if a requirement of that act would have been that every citizen had an annual blood test? Could we tell a lot more about that?
That's a tough statement for me to make. I don't have enough
knowledge
per se. Probably, but I think really what we need to do as a society, we need to change. We just need to change. I mean, I don't really think that we need to go to our physician to get on a scale and see how much we weigh and see how tall we are to know that we're overweight. I fight my weight every day. But I think people, you understand what I'm saying? I mean, I think it's simple. If you look at your BMI, your body weight, your body weight index, just going to get on a scale and take that number and put it in your iPhone with your height, and it'll tell you if you're obese or not, and it'll tell you what your risk factors are. I think, you know what I'm saying? I mean, people have to look at this and really take it seriously.
10-year-olds do that now. They can use those iPhones that way.
So that's why I say to go to, and this is just my opinion, for everyone to go run to their family physician to have him look at you and say you're overweight, I think we all really know that. You just have to address it in some kind of logical way, which is watch what you're eating, get on a better diet, exercise a bit. And the same thing as I said about smoking, I think with being overweight is don't throw the towel. You had asked me, one of the last questions you asked me on the radio show is what advice I would give. And I kind of said, have everybody go to the gym just a little bit. You remember me saying that?
Yeah, I remember.
Something I should have said better is that no matter how bad a shape you are, your body will recover, right? I mean, if you've abused your car for 30 years and then you try to take it out on the road, it's going to need a lot of work on it, right? You got to spend money. Your body's a little bit different. I mean, generally, if you're generally healthy and you don't have a chronic disease, if you start to lose weight and exercise, you will lose weight and you will get healthy, right? I mean,
so it's really up to a person to make a decision.
Don't throw the towel in on yourself.
Yeah.
No matter how.
When I mentioned cholesterol, stress, blood pressure, weight, that's something we can all address.
Right. It's not very exciting to address, but and I'm not here to tell you there's a magic formula like some of the doctors on TV will tell you, because there's really not. Because if there was, I would have taken it already. But it's really just exercise and weight.
I tell you, every time I drink a McDonald's milkshake, and I don't do it very often, I thoroughly enjoy it.
So do I.
Thank you, Dr. Sims. I hope you, our viewing audience, has enjoyed our show today.